Hello, everybody. Welcome to Very Connected Podcast. And I'm really excited. We have our special guest here tonight, Kayla. Kayla, say hi.
Hello.
Um, Kayla's joined us before on a couple. So if you've been here with me before with Kayla, you know you're in for a special treat. And it's one of our most requested topics. You know what? You guys tell us, we listen, and we did a poll for November and December to determine to determine what topics were your most requested. And so I went through all of the topics, and your very top one was what we're doing tonight, which is like life and maintenance. And we're talking about, maintaining, we're talking about plateaus, we're talking about regain. And Kayla is a dietitian, so she has a lot of experience working with lots and lots of bariatric patients on this topic. And Kayla, without having to read your bio, because I want you to like tell a little bit about yourself before we do this. Um, oh, we have a lot of people saying hello. Yes, guys, please tell us hello. Tell us where you're from. Tell us what community you learned about us or how you learned about us. Um, Tell us if you're pre-op, post-op. Tell us something about yourselves because we definitely this is a support group. And so Kayla, before I say anything about myself, I want you to just tell about a little bit about you. Tell us.
Yes, so I'm seeing
Those
a
are-
lot of familiar names here, so I love that. Hello, and I'm seeing people from really warm places, so I'm a little bit nervous. I saw an aloha, and I'm like, I bet Hawaii is just beautiful right now. But for those of you that don't know me, my name's Kayla Girgen. I am a bariatric dietitian, and for exclusively for the last 2 years, I've worked virtually online with folks before and after bariatric surgery. And prior to that, I was actually in a surgical clinic. We did kind of some medical weight management and then surgical. And once I left the clinic, I will say for some reasons, I think what I saw as a clinical dietitian was just kind of following a lot of those protocols. It's like, okay, here's your sheet of 16 things to do before and after surgery. And it's like, that's not always helpful. And I think it's just so one size fits all. And sometimes that gets missed in the surgery clinic or when you're trying to hit certain criteria as a center of excellence or whatever the case may be. I feel like sometimes the individual gets lost in the mix. And as I parted ways, I had some patients hunt me down, and I maybe see some names here tonight. But thanks to them, I really kind of tailored my weight management coaching to really bariatric specific. And I was like, wow, like I never imagined working with bariatric patients outside of the clinic. And thinking back to my days in the clinic, I really think that there's such a support gap. And a lot of that drops off after the first 6 months or first 12 months. It's like, okay, well, see you in a year. And I think oftentimes that's when really the real work begins. Some of the benefits of surgery, like some of those hunger cues might start to come back. And that's why I really love this topic tonight about maintenance, because it's like this big elusive topic. Like, what is maintenance? It's different for everybody. And when we talk about things like regain, I think a big part of that is just learning how to prevent that, which we're talking about today. So I love that we're here for this and co-hosting with you. You're one of my favorite people, Brenda.
Oh,
So
thank you, Kayla. I feel the same way. I really do. And oh, we have so many beautiful people joining. I just want to say hello to each and every one of you guys. Thank you so much for being here. Oh, hi Amanda. Oh, she's so sweet. And we have people that are pre-op, we have people that are post-op, we have different surgeries, we have different states and areas. South Florida, I see Massachusetts, I see Hawaii. You're right, Kayla. Oh, I'm so jealous. That sounds so yeah, actually today was a little bit warmer. We were in the 30s today. We've been in the zeros like this week. So, and so Kayla, my background mimics yours a little bit. I know for those of you guys who may be new to this platform, I'll be super brief on my little background. My background is in nursing, and I've been a nurse for some time. I worked emergency department for about 30 years. I'm sorry, 20 years, 20 years. Don't want to make myself older than I am. And then I did quality management for a while, and then I got into the beautiful world of bariatrics, and it was um, it was just amazing. I fell in love with it because whenever I worked in the surgical part of the hospital, I worked in med surg too, in the in the ER, you're fixing all of these things and people don't always want to be there. Like obviously they need medical attention and they need help, but it's not something that they're really deciding. It's not elective. It's not elective. And so bariatric surgery I soon fell in love with because I just have a special passion for helping people in that way. And because I had such a long history in the ER, I knew that I wanted something more of just acting like reactively. I wanted to be able to help people more preventative and things like that. And knowing what causes people to get sick and what causes people to heal and knowing more about them. So I did do some studies with holistic health and I try to incorporate some of that. I've studied personal development for probably the last 20 years just because I'm so in love with like really empowering yourself, you guys. This is all about you, and you're making such life changes. Wouldn't you agree, Kayla?
I
Like,
agree 100%.
ah,
Mhm.
it gives me
About the
chills because
mindset. Yeah,
yes,
mindset and metabolism.
it's a combination of so many things. And when you make up your mind, you guys, you can do anything, like anything. So don't let anybody else ever tell you otherwise. Never. Um, so how about we jump in, still people joining and saying hello. So thank you guys for being here. Oh my gosh.
As you pull that
Just
up
all
too, I
different
can relate
patients.
to everyone who's like freezing. I'm seeing all these like sub, zero temperatures. I'm in Minnesota, and if you can't tell by my accent, try to shield it a little bit. But I tried to get out for a walk today, and I was really proud to get some fresh air, but it kind of sucked. So that wind and that cold. Yeah.
I feel yeah. That's something I've been wanting to do, and I'm gonna have to push myself because I have been reclusive. Like I work from home, and last night I got to go. I live in Missouri, and I got to go to a support group. It was actually an in person. It was a New Year's party for patients, and there was like over 200 people there. And it was so exciting to be in person for once because, I'm not getting to be around people all that much. I'm around people all the time online, but to actually see them and hug them and stuff. So that was exciting. Um, oh my gosh, -22 in Alberta, Canada. Holy cow. We got some Nancy from Marion, Illinois. They're one of our very big supporters. So the Dr. Huja group, thank you so much. Yeah, you guys, thank you. We could just keep reading because there's lots and lots of comments. Can't keep up with them, but just keep commenting because this is for you guys, and you guys can connect here on the chat features too. So let's get started, Kayla.
Let's do it.
Guys, I'm gonna first by starting to share my screen. And before I do that, let me make sure that I have stuff pulled up on the screen that I want it. Because sometimes it goes to it'll go to whatever I have pulled up. And I want to make sure that it goes to the right place. And we are gonna start with the ProCare website because ProCare is our sponsor. I just want to give them a huge shout out. Yay. And Kayla is actually been a supporter of ProCare all along. So thank you, Kayla, so much. I want to say, guys, the handouts for today's presentation. If you have to jump off early, no, you can find our information on replay. This using the same link, so that link will be available till the end of the month. We put everything on our YouTube channel, which I'll show you here shortly, and then we also have our handouts under procarenow.com. If you're listening to the replay on a podcast, sometimes we'll have replays on that podcast, Very Connected. Just go over to procarenow.com, click on the Very Connected tab, and then there's a support groups handout. When you click on that, you're going to find the handouts for a lot of our different programs. So go in there and check it out. There's other stuff on there too. You might find something else that helps you. And right now we're here approaches to life and maintenance, interventions for plateaus and regain. It's one of the very first things here listed, and we have the presentation and our resources. So I'm going to go ahead and jump on to the presentation with Kayla here. And um, Kayla and I is going to kind of split this up a little bit. We're going to be talking a little bit. And I just want to say, guys, we're going to be pausing in between. Continue to place your comments in the chat box, to chat amongst yourself. We'll be watching those as we go through. And then also there is a feature that's a Q&A button. please feel free to, if you have a specific question you want us to address, we can definitely do that. Put that in the Q&A because it's easy for us to find in that little box there. It's a question, okay? So in the meantime, let's get started here. And this is our little agenda. It's setting realistic expectations, the recipe for regain. I'm excited about that one, Caleb, because it's not going to be just what they think. I think that we got some little surprises there for them, just from
I
personal
agree.
experience.
And if you're going to maintain, you have to know what prevents regain, right?
Yes, yes. And I think that that's where I know for myself, like having bariatric surgery, I didn't even mention that. Some of you guys probably know, but I had VSG surgery back in 2012. And for me, there is a recipe. There is. Um, I think there's a lot of different things that you can do. So wherever you are in your journey, know that we're here to support that. And how to bust stalls and tackle weight regain. How many of you are looking for that? Let us know. And exploring tools for support. Yeah, let us know why you're here. Let us know what's important to you. So that is the next box. How did you get here? 1 to 2 reasons. If you've hit a stall, or maybe you're pre-op and you're just looking for a way to prevent that from happening. Maybe you're early on and you're seeing like little pivots. Sometimes that happens early in the game. And honestly, no matter where you are, whether you're 4 months post-op or like 1 month post-op, 4 months post-op, or 12 years post-op like me. So I'm going to take the screen off for just a second so that we can kind of look at some of these comments real quickly here.
I see this all the time, Brenda. So I'm looking at our first couple comments and I'm seeing like petrified, and that's always the word that I hear used too, like petrified of weight gain. And we're going to talk about that too. I think later in the presentation, we have a list of like 5 or 6 reasons for regain. And that's not a list from Brenda or a list from me. It's actually like from the literature that shows what are some of the common reasons for regain after surgery. And I think oftentimes we just don't have a lot of education on that. We get the list again of like things to do and don't do after surgery, but I think some of that like later maintenance stuff that comes maybe at a year post-op sometimes gets missed. So hopefully you'll pick up some good tips from that today.
Yeah, I think oh my gosh, the comments keep coming. A lot of it's maintaining, some of it's kind of just fear of having to have regain. Um, some of it's a little holiday regain, which can happen. Okay. Well, this is all helpful. We're going to keep reading these guys. I want to say though, too, I just want to reinforce you guys, no matter where you are on your journey, it does not matter as far as where you are. If once you get it set in your mind and you know that you want to make it a directional change and you have a willingness to do that, there's definitely some things that you can do no matter where you are. So please keep faith, keep hope. It also has a lot to do not only with what you're eating, but your mindset. Um, you know, some of this, if your subconscious is playing a part in this, knowing that you can look at that, like become aware and know where those patterns are coming from and like jump out of that. So we're gonna give you ideas. Right, Kayla?
Yes, absolutely. And we'll try to
Okay.
make it, not just the generic, eat more protein and drink more water. So
I
if you came
know.
here expecting that today, we're going to give you much more than that.
Because really and truly, if you go to your surgical program, that's what we're all trained. I mean, I worked in a surgical program as a bariatric coordinator for 8 years before I worked for ProCare. And what I want to say is that's really what our main goal, what our main focus was always on. Obviously, the big thing is the nutritional part and stuff, but there are other things too that kind of go along with it. So you know, asking yourself, I think it's becoming super hyper aware of where you are, what you want to accomplish. I think it's like knowing yourself, like how realistic are your expectations? Are you pre-op and you have these expectations? That's okay. That's okay if you do, but um, just be aware that there's going to be things that you need to do to push yourself through if you really want to have those happen. There's different weights associated with different surgeries. Some of them may be a little different. So if you go into knowing like what other people's accomplished, sometimes that's helpful to know, you can do it too. Are you stuck in the comparison trap? Now, I have something to say, but before I say that, Kayla, what would you say about the comparison trap?
It's always so difficult because I see a lot of clients that I work with like comparing themselves to someone who's maybe a similar height, similar starting weight, maybe they had surgery around the same time and someone's so far along, but I think it's always so difficult because we don't always see we kind of see that outside journey from a lot of people, but we don't always know you don't know someone else's circumstances or what they're going through, so or for yourself for that matter. So I see a lot of people maybe have an unexpected death in the family or they maybe do a job change and those are a lot of life stressors that kind of add to having to adapt and that might mess up the plan and you might have a little bit slower weight loss just because you have different circumstances. So I think in short, really no two journeys are the same and unfortunately that makes kind of finding what works for you a little bit of trial and error. So I would say treating things like an experiment really helps, but comparison, like you said, can help when you know that other people, like you mentioned, like you see other people do it. So you're like, I can do that too. But I think in some ways you can almost compare too much. And that gets to be a detriment when you're really kind of getting down on yourself because, someone else is 10 pounds further than you or 80 pounds further. And you think that you should be there too.
No, totally right. How do you know? Like, my question would be, how do you know if the comparison is helpful or not comparison helpful? And I would say how you know is listening to how you feel. If it brings you motivation, if it brings you inspiration, if it helps you use your imagination and to create an idea in your own mind of how that can help you, then it's helping. If you feel your emotions dropping and you feel yourself disappointed or feel like a failure or feel sad or frustrated, then that compares, Kayla.
What was the last part? You cut out right at like
It,
the last few words.
oh, did I? I just feel like if you find yourself in a place where it's bringing down your emotional state and it's making you sad or unhappy or frustrated or angry or whatever, then it's the comparison isn't helping you. If it's motivating you, inspiring you, and it gives you the idea and the willingness and imagination to create that in your own mind, then it's helping you.
I agree. Yeah, 100%. And I think nowadays with social media, we can really easily compare. So I think too, like sometimes I'll have my clients do like a social media detox. Like, okay, if there's certain accounts that you're, really kind of obsessing over or seeing what they're doing, if you're walking away from that, like you said, feeling worse than when you went to that account, maybe it's time to unlike or follow or hide them and just follow accounts that maybe look a little bit more like you. Because I think oftentimes too, we might be following like bodybuilders or, somebody that's just not our body shape, like looking at, really realistically at your goal weight, what does that look like? So if you, started out and you were really curvy and now you want to look lean, it's like that might not genetically be, really realistic. So I think part of that is just kind of realizing what your expectations are too.
Yeah, for sure. I know the day I had weight loss surgery, I was actually working at the clinic and the surgeon that I was working for actually did my weight loss surgery. And there was two other people that had surgery the same day. And I can recall one of them, my BMI whenever I first started, guys, was 35. And sometimes I'm almost scared to say that because I kind of felt like sometimes I was being judged because everybody's different. I was judging myself. Nobody else was probably judging me, but so it was a lower BMI to start because 35 is the qualifying factor to have weight loss surgery and you have to have comorbidities. So I had um, high blood pressure, and that helped qualify me for my insurance. And my one of my the other guys that had surgery the same day, his BMI was 60, and so he had a little bit more weight to lose than I did. And so at our 3 month, I had lost maybe I want to say maybe 20, 25, and I was right on track. And he had lost almost 50, and then our 6 month, he had lost over 100, and I had lost like 50. So, you have to like, if I was comparing myself, I was right on track, right where I needed to be. And it was more weight that I had ever lost on a regular typical diet. So I just want to say, if I would have gotten stuck in comparison, his situation was much different. He had a lot of other stuff going on. So I hope that makes sense, guys. I hope that makes sense. Um,
I did want to point out too, Sarah commented, compare for direction, not detail. So I like
oh, I
that. Kind of
like
helps like
that.
navigate you in the right direction. So I like that.
Yes. And I like this. Amy says, surround yourself with people who have the same goals as you. And yes, even though we had weight loss surgery, not everyone was following the plan. It's okay to walk away. Yeah, and I know I noticed that first year, the people that I surrounded myself with made a difference. Like one of my work colleagues had weight loss surgery. She was my fellow coworker, worked in the office with me, and we had surgery, and so many things helped me, us being together all the time, but there were a few things that maybe caused to slide a little bit, and I had to ask myself, you guys always have the right and the decision to make your own choices. We should never blame anybody else for the choices we make. They can influence us. You have to ask yourself if you're being influenced by someone else and if that influence is helping you or hurting you. So um I also want to say surgery is a tool. How many times have you heard that? It's not really a magic pill. It's not a fix all. There's still going to be like your own active participation. The surgery is on your stomach. It's an anatomical change. It definitely is a great way to help you have less appetite. For some, many people, it also helps with your metabolism. A lot of people will not absorb the same rate as what they did before surgery. It may help you eat less. Most likely, I would say 99.9% of people, portion size is dramatically decreased. So those are the big things that it will do. Will it fix your mindset? Kayla, what do you think? Does it fix your mind?
I think that's one of my favorite quotes. Like you had surgery on your stomach, not your brain.
Oh,
And
I haven't
yeah.
heard that, but that's true. You're right.
Yeah.
Let me ask you, does it fix the way you're eating? Like, let me ask you, because you're a dietitian, does it fix what you're putting in your mouth?
I think it, you get some of those metabolic benefits where maybe you don't have, and again, like this can differ like case to case, but a lot of times people don't have as strong of hunger cues. Maybe you fill up really quickly, or you don't even know that you're hungry. If you do feel hunger, that's totally fine too. But I think some of those things can really help eat in terms of when you're not starving all the time, it makes it a little bit easier to make the healthier decision. But I think also, I think surgery sometimes is like that measure that makes people really heighten their awareness on a lot of their choices because there's a lot of pressure that comes with surgery, either to perform for yourself or if you've shared your journey with others like family or coworkers, friends. I feel like you don't want to let yourself or others down. So you really kind of buckle down, I feel like. And I think naturally, like just that act of having surgery really changes your life, in a huge way, including what you eat.
No, for sure. Yeah. I feel like it gives you the ability to make better choices, because it is a tool in all the ways that we talked about. But you still have to be the one making those choices. Like it's still up to you to make the choices. Joan says, I'm an older woman, 63. I want to improve my health. I have been very nervous. Now, Joan, I'm right there up with you. Believe it or not, I'm 53. So I understand. And I will tell you, I know the weight loss surgery program I worked with, that we did surgeries on people in their 70s and maybe even 80s. I would have to think back a little closer, but Haley, you've probably worked with people all ages too, right? Like
Mhm.
age does not matter. And really, you're talking about quality of life and health.
Right.
So
I've seen it. I did my internship at the Mayo Clinic in Rochester, and even at that point, they were performing surgeries on teens. So I really kind of saw bariatric surgery from the scope of, maybe 15, 16-year-olds all the way up to, like you said, 70. So really there's a big spectrum. Hmm.
it's incredible. Now that you say that about children, actually, I was at a OAC conference this year, Obesity Action Coalition, Your Weight Matters conference, and they had invited a group of teens. There was one girl there who had had her surgery. I want to say it was 14 or 15, and I didn't even know they went that young. I thought they didn't go any younger than 16, but it was under 50, it was under that age. And then I think it was a group of maybe five or six, and they were all right in there, had their surgery right around 16, 17, 18. And I was like so impressed because like what a life change. And I know it would take it takes this a certain clinic. Not all clinics do pediatric surgery. So anyways, I got a lot off on a tangent, but this next one, what skills will you need for long-term success? And we're definitely going to get into that. But like, what do you guys think? Comment.
I would
Let
agree
us,
with Amy here too. She said the biggest missing or the biggest puzzle piece that's missing is mindset. And I think oftentimes that really isn't emphasized enough. And I think sometimes you're in the throes of navigating life after bariatric surgery, and then you really, you really hit that one hard.
yes, yes. And we are gonna like hit a lot of these things. And guys, I know Christopher says, Christ I hope I'm saying that right. Chris Christopher or Christopher spelled a little different. I like that. 63 and I had my surgery 1 year ago. And I have so many the comments are still popping on, so it just threw my screen off a little bit. Um, Kayla, can you still see that comment? Because it's buried
Yes,
now.
says I'm almost 63, had my surgery 1 year ago. So glad that I had that done. Going okay, some regain, which is why this particular presentation interests me. And if I remember, Christopher, I think I use his like clear your cache. I don't know if that was you. You'll have to let me know. But I stole that from you. I know that was talking about mindset. If that was you, I know he had just mentioned like journaling, kind of like clearing your cache at the end of the day. And I have to thank you, throw that shout out. So
Oh, I
thank
love
you if that was
that.
you.
That's a great way to say
Yeah.
it. And I will tell, I'm going to be clearly transparent, you guys. I have worked on my own personal growth for as long as I can remember. I mean, I remember when my son was he's 28 now, and I remember whenever he was starting kindergarten, and I really was jumping in at that point. So I mean, he's 20, that's probably been 25 years. And to me, it's been one of the most important things. But this year is my year. I am like, it's going to be the one of the biggest years that I've had because I am like diving in full strong and I'm taking the time each day to do things that's going to just make incredible leaps in my journey. Because every year I always like to look back. And this is a great time to think about all of these things we're doing. We're setting intentions for the next year and what we're looking at. It's not just the next year, but all the years to come. And it doesn't have to be what we call resolutions or goals. I like just really getting clear because guys, where your focus is where you're going to see your your dreams. That's what you're going to see. Whatever's in your mind is going to show up in your life. So, great. Okay, I kind of get on a tangent there. Here we go. Factors that influence weight.
Yes.
Kayla.
So I I just wanted to kind of zoom out for this slide in particular, because I think a lot of times when we think about weight loss, we think about calories in, calories out, eat less, move more. And I see that even oftentimes like after bariatric surgery, you have this tool, but we don't always recognize like all of those other like lifestyle factors. I think specifically sleep. Oftentimes, when I'm working with clients, we don't even work on nutrition. We work on nutrition related things, but maybe a bigger piece of that is, focusing on like things like sleep, for example, or stress management, because we have, as humans, we live pretty high impact lives. We have a lot of things coming at us at once, and physically, lifestyle wise, there's so many different factors. So it really bothers me, I would say, as a dietitian, to hear calories in, calories out. Just to kind of again zoom out, you might see something on this list that really stands out. Maybe there's a couple where you're like, ooh, that's kind of like the squeaky spot in, my life. Maybe I just like need help managing emotions, or maybe I'm going through some sort of illness or injury, and just giving yourself some grace in those periods. But just recognizing that weight loss and weight maintenance, as it relates to this conversation, really is so much more than just tracking macros and hitting protein goals. It's really a big holistic approach. And when we look at maintenance, I think it's finding a balance and recognizing that different seasons of life are going to evolve, and your attention might go from, maybe that first year post-op. For people who are newly post-op, maybe your focus really is on nutrition. And then as, life, as as you get further from surgery, maybe that evolves and you're looking at things like activity or a stressor happens and things change. So all of these things tend to ebb and flow.
And Kayla, can I add something there to that?
Hmm.
Okay, wonderful. So, for me, guys, these slides are going to be available for you after the presentation if you join late, just so you know it. They are on the ProCare site. We'll go back and show you where to find them again. But, um, like really, if you guys hit a plateau for me, like the last 5 years, I've been the same. And this within the last 6 months, I made some major changes because I wanted to I had regained about 30 pounds and I wanted to get that back off from my first. I'm 12 years out, so I knew I hadn't really gained any recent. It had just been like I had gained it slowly and then the last 5 years stayed the same, and I knew that I needed to look at more. And so for me it was nutrition. I had to look at what I was eating. I had to look at my hormones. I actually went and seen a hormone specialist, and also looked at my medications, like because I know my blood pressure was a little bit out, and started on a GLP-1. So started on hormone replacement therapy, GLP-1. I also have been really looking at emotional. I took some, I don't know if you call them classes, but I did some empowerment work on that. Um, and so you look at these slides and see if there's something on here that sticks out to you, and start there. And if you can't do it yourself, you guys, there's always other people out there to help you. So that's just my little 2 cents.
And I will say too, like on your last comment, like finding somebody to help you too, because I think oftentimes when we maybe recognize something, we try to do all the research ourselves and find the perfect plan. And sometimes it's just easier to have somebody figure that out for you. It's a lot of work to try and figure it out. And a lot of times, I know a lot of the gals I work with have ADHD or just, anyone who's doing research on any one of these topics, you get conflicting information and it can just really help to have somebody say, nope, this is maybe what we should focus on. Let's focus on these two things instead of trying to do all the things and really not getting anywhere. So don't be afraid to ask for help.
Yeah. Okay, I'm going to go to the next slide here. And I know somebody asked about hormones. Yes, hormones are a huge, as far as from what I understand, from what I've been told, can be, and I know it's made a big difference for me, you guys. Already almost hit my goal. Like, so in the last 6 months, lost, I'm at 35 pounds actually. So I'm less than where I was before. So no matter how far you're out, I'm
Amazing.
12 years out. Yes. So I'm excited about that. And just knowing that you can get the help. And I do think hormone replacement was a big factor in that.
Hmm.
So
Absolutely. And I think that's like kind of a scary topic for a lot of people is like hormone replacement therapy. It sounds crazy. And yeah, so don't be afraid to ask. That can help in a lot of different ways. Hmm.
I like how you mentioned ADHD too, because I've heard several in the bariatric community say that they've reached out and gotten help for that, and that's have been helpful for them. Um, I'm looking to see if there's anybody else, because I know in the question box here we have reasons for weight gain and share your guesses for regain. So
Yeah, if
kind
you
of
guys have
looking.
any guesses for, so we've got like 5 or 6 big ones that lead to regain according to the literature. So if you've got some guesses, drop them in the chat box. And then
Yeah.
while you guess in there, I just wanted to hit um, on one question here from Crystal. She asked for some actionable things you can do to support gut health. And I would say one of the number one things is fiber. So that's something that I see intake go down quite a bit after bariatric surgery, just because you can't always tolerate fiber real well after surgery. Plus, all you're eating is protein, and protein tends to not have a lot of fiber. So that tends to be one, but I will say getting fiber from things like vegetables, fruits, beans, but doing it gradually. Sometimes I think with improving your gut health, if you're not used to eating a lot of vegetables and then you eat a lot, you might end up feeling bloated, gassy, things like that. So it's something to kind of increase over time. Fermented foods can be good too. So if there's any sauerkraut fans or kimchi, kombucha, things like that.
Didn't you tell me you were making some of the kombucha?
I
the last
did, and then
time?
I forgot about it, and then it like started like my whole container like turned into a one big SCOBY. So that's like the disc that has all the organisms, and then my house stunk like kombucha. So I just got too lazy and I didn't bottle it. So I'll probably start that up here. So
And you can buy that. I know at Walmart they have it. Kayla, what would you say about probiotics for gut health?
I would say sometimes just making sure they're third party certified. So I think with a lot of supplements, I know like ProCare, for example, you guys do third party certification and are very transparent and post all of the like your test results on your website. So that's one of the reasons I love ProCare besides the people like Brenda. But just looking for something that's third party certified because there's so many supplements out there that unfortunately the FDA just doesn't monitor or recommend. And I think sometimes you might see probiotics in the refrigerator and then you might think they're more legitimate, but I don't know, some of that can be a little bit of marketing too. So
I agree with you. And you know, you guys, what I'd say sometimes is you have to be willing to fail to I don't want to say fail in a way that's bad, but I want to say, you know, don't be if you're a perfectionist and you're afraid that you're going to do something and it's not going to help and you're just going to be back a track, you're never going to do anything. So, and that means, I'm saying don't be afraid to trial and fail in order to continue. Because if you never try anything different, you're never going to see any change. Like if you keep doing the same thing over and over, you're going to get the same results. Sometimes it just takes introducing different things, and sometimes it takes more than one thing. You know, you gotta kind of try. There's a lot of comments here about what the
yes.
question originally. Do you want to read some of those, Kayla?
Yeah, so I'm seeing let's see, return of unhealthy habits, grazing, binge eating, habits, not tracking, hunger returning, stress, old habits, eating too many times, binge eating, stress, return of hunger, stress eating. Are you hearing the common themes? Mindset, life stressors, sleep. Yes, all of those things. I would say, do you want to scroll to the next one? We can reveal some of.
Yes, I do. I do. And I want to say something about the mindset before we kind of go on
Mhm,
to one thing I want to say about that is, guys, that is something you almost have to work on every day. It's not like just a pick and go, you know, it's if you're finding the same things resurfacing in your life, then you know where you need to work. So, okay,
mhm.
here you go.
Absolutely. So, for those of you that put snacking or return of old habits, one of the number one reasons for regain is grazing. And what grazing is kind of that constant nibbling throughout the day. And what I find, especially after bariatric surgery, is that I see a lot of people are really scared of regain. So they purposefully maybe undereat. And when you're grazing all day, that really makes it easy to outrun your restrictions. So not only are you left not physically satisfied, but sometimes I think emotionally too. So oftentimes I think one fix or workaround to that is just getting a little bit more volume when you eat. That can help satisfy you a little bit longer. We'll talk about protein. I know one thing I don't think we have worked in the slides at all is just getting a good mix of like fat and fiber too. So I think fat, sometimes I see a lot of recommendations nutrition wise from surgery centers where it's low fat everything. And I think sometimes that puts patients at a disservice because you're not getting that good quality fat. And oftentimes that's what leaves you feeling satisfied. It helps with your blood sugar levels. So for anyone who's maybe followed me, I like to use CGM or like glucose monitoring. So I see with my grazers that their blood sugar is up and down and up and down and up and down because they're eating so frequently. And then you're just kind of rebounding and chasing your blood sugar all day, kind of on that roller coaster. So one workaround is to try to get to even like more mini meals, trying to scrunch up maybe that time in between meals versus just that constant nibbling. On the other end of that, I would say eating past full. So whether it's just maybe eating too fast or eating out of comfort, I think for a lot of us, food brings a lot of comfort and that fullness can help. So really diving into maybe the reasons why you're eating, or again, like maybe it's a speed issue if you feel like you're just eating too fast, not weighing. And I know there's some mixed feelings out there with the scale, but I think sometimes ignorance isn't always bliss. So I think weighing is a data measure. So it can help just show you where you're at. It can show you if you're in that maybe 5 or 10 pound range that you want to be in. It can show you if you're making progress. You don't have to weigh every day, but if it's maybe been a while, maybe that's step one, just to kind of meeting yourself where you're at. So not weighing, again, this is from the research. This isn't my list, but not weighing is one reason for regain. Lack of physical activity. So that I think is something that's really underestimated, especially with like metabolism and metabolic health. We spend so much of our day sitting like we are now. And I think with COVID, that got even like exaggerated more. We weren't getting steps to go to the car or go into the office. And now we're, a lot of us are maybe still working from home and from screens. So I think activity, that impact and just how you use fuel, the things that you eat to help fuel that physical activity can make a really big difference. And then the last two, psychological disorders. So if you feel like, we've been talking about mindset, we haven't really touched on mental health, but if you feel like there's just things that you need help with and you're not good, then it's important to get some help. And I think one thing, thinking back to our notes, Brenda, I think you had a website. Was it findabariatrictherapist.com? Is that right?
Yeah, I I'd have to look at yeah, find a bariatric therapist.
Okay.
And that is by Ashlyn, who is a therapist and actually will be on our podcast sometime in the future. But yes, she is a bariatric therapist who created a site. Thank you for reminding me of that.
Yeah, because I think if you don't know where to start, I think a lot of people are hesitant to reach out. But then if you have someone who's maybe specializes in, bariatrics, I think that can be helpful too. And then lastly, life stressors. I feel like that's always, life is always going to throw curveballs your way. So knowing how to deal with that and manage that. And I have a couple slides later on that kind of show the impact of stress, because I think that's one thing that's just like sleep underestimated when we look at all that list of reasons for what impacts weight in the long run. So back to basics. I won't spend too much time on this, but really we've kind of got 9 big things. I don't want to like beat a dead horse. I feel like everyone probably knows, eat protein, drink your fluids, but I will make a couple notes for things like protein, for example. I think when I see a lot of recommendations, 60 grams just is not enough. So I feel like a lot of times that's a good first goal in your early stages after surgery, but really, I think to sustain muscle mass, which if you're losing really, really fast, it's important to hold on and retain as much muscle as you can if you want to really preserve your metabolism in the long run. So oftentimes I'm telling my clients maybe 80 to 100 grams a day. I know ProCare, you've got your protein that you launched, I think a couple years ago now already. But it can be a shake. I think sometimes people think it's got to come from all whole foods, and I haven't even had surgery and I can't get 100 grams a day without a protein shake. And sometimes that's just good insurance for the day. If you know that you can get, have a shake and you've got 20 or 30% of the way to your protein goal for the day. So I think that can really, really help. And my last note on protein is just trying to get 30 grams with your first meal. Unfortunately, a lot of our breakfast foods like muffins and toast and even Greek yogurt or eggs, they might not have as much protein as you think. So like an egg, for example, if you're doing 2 eggs, that's probably like 12 or 13 grams of protein. That's halfway, not even to like that 30-gram goal. So maybe you help your eggs out and you scramble them with a little bit of cottage cheese and shredded cheddar, for example. But just trying to kind of beef up that first meal of the day, especially, can really, really help. Fluids, I would say my only note there is I think one myth is that you can't have fluid before meals. And I feel like for some people that try to follow that rule, it really kind of hinders them. And there's really no research that supports that avoiding fluids 30 minutes before meals. On some hands, some people feel like it just fills them up and then they can't eat as much. And then that leads to grazing, which now you've learned that that leads to regain. So if that's, if that's you, then maybe you still abide by that. But for most people, they tolerate fluid, well up until mealtime. So on supplements, being our ProCare specialist, do you want to cover that one?
Sure. I mean, I guess depending on your program, the recommendations can always be just a little different. And I always have to tread water because, like, I didn't realize how much different they were. But after doing support groups all over the United States, I can tell you there is differences. What the ASMBS the ASMBS, what they recommend, and the ASMBS is the American Society for Metabolic and Bariatric Surgery. They're kind of like the accrediting agency. As Kayla was talking earlier, if you go to a hospital that's accredited, it's called the Center of Excellence, and the accrediting body for that is the ASMBS. And what they recommend is a multivitamin daily with iron. Okay. They recommend calcium with vitamin D3 and though at least those two things. Now, B12, D3, those the B12 sometimes will be in your multivitamin in your oral form. Some people will take it by shot or nasal spray or a different format because it can be um, better absorbed. And depending on your body's absorption rates, how you absorb it may be different than others. But probably minimal is the multivitamin with iron and the D3 with calcium. And then if needed, additional B12. And if you've had a SATI procedure or a trying to think, DS, duodenal switch, or any kind of like revision that you've had more of your colon rerouted or had some differences. There may be differences in the supplementation you need. A lot of times those procedures will need more of your ADEK, which are your fat soluble vitamins, and possibly a little bit more calcium. So hopefully I answered that.
Yes, no, that was perfect. And before we move on to the next one, I just wanted to answer, there was a couple of questions about protein specifically that I wanted to touch on that come through a lot. So one is just, is it okay to go higher than 100 grams of protein, especially if you're lifting weights and physically active? I would say yes. And to piggyback that question, Vera asked, can you get too much protein? And she's talking about like 120 to 140 grams a day, including a shake or sometimes two. And I would say, I don't know that there's really a maximum on protein. I would say, I think sometimes there's a myth that it's bad on your kidneys, but unless you have like poor kidney health, then that's probably not a concern. But on the other side, sometimes I see like protein displacing other foods. So for example, someone had asked about gut health earlier. If you feel like you're getting lots and lots of protein, maybe you're constipated because that's one of the side effects. Maybe we scale the protein back a little bit so you can get some more vegetables and more fiber in. So I would say it kind of varies case to case, but sometimes protein can displace when you get maybe north of 120, 150, depending on what your kind of target weight or what your activity looks like. But just keeping in mind that not wanting to eat 100% protein all the time might not be the most helpful too. So hopefully that helps touch on those a little bit.
Yeah, perfect. Are you ready, Kayla, to go to the next
I
slide?
am, yes.
Okay.
So we talked about snacking and grazing. So grazing being one of the big reasons for regain. One of the big number one reasons for regain, I'll say like by a big percentage if I remember right. So I think the biggest thing is just to avoid, I should have been a little bit more specific and said avoid grazing, because I will say there is a difference between having a snack and grazing. So having a planned snack, something that maybe you've got that you bring to work, or something with a little protein and maybe some healthy fats. And in our resource sheet or on the ProCare website, we do have a resource sheet linked, and I do have a free grocery list download if you're looking for more ideas in terms of like protein, fat, and carbs, what those categories look like. So you can get that on there as well. But just trying to really avoid that grazing more specifically than the snacking. So sleep, I can't. I know I'm seeing some familiar clients on here, but I feel like sleep is always one thing that I go back to with people. We're working on nutrition, and I feel like sleep so often because it is one of those things that really impacts your blood sugar levels. So you hear me talk about that a lot, and I have a couple slides here shortly that when your blood sugar is going up and down, your mood is up and down, your appetite is up and down, inflammation is up and down. So sleep is one thing that can really just help reset you mentally and physically as well. And oftentimes we're on screens late at night, or we have so much input going throughout the day. Maybe we need something like a little bit of output like journaling or stretching, things like that at night, just to help you calm down so you can get some good quality sleep. And, think about the days that you have really good sleep, like how awesome that feels. Or on the other hand, like maybe some days you have a really crappy night's sleep and you're tired and you want sugar and you want carbs and you're cranky. Like if we can prevent some of that and get good sleep, I think that has a positive ripple effect because then you have the energy to work out and make healthier decisions. But maybe I'll have you scroll for the stress management because I have a couple examples
Sure.
for.
Absolutely. And I want to say, I think for you, you mentioned about the screen time and all that. I think for me, the biggest change that I saw is in my sleep was when I took my computer out of my bedroom, my phone out of my bedroom, and it was quiet. And
Mhm.
our TV, my husband did not like that. That was a big fight. But honestly, it was almost like even though none of them were even necessarily turned on and I wasn't on them, just them being there, there was a presence. Anyways, I just had to say that.
Oh, it's such a huge difference. And I think we don't think about it. Our phones are right there and always there to distract us from things. So the more you can put them down at night, especially, I feel like, I just read a quote the other day and it was like, oh, I can't sleep. Let me put like all the answers to any questions I ever wanted, like 3 inches from my face. And it's like, exactly. Uh, and Amy asked how many hours. I would say it's more, how often you're actually sleeping. So if you're laying in bed scrolling TikTok, that's not sleeping. But I would say 7 to 9 hours for some people, and that's like actually sleeping. So I know one thing I use is like my Aura ring. I absolutely love it. And it tells me when I'm stressed, if I got good sleep, it tells me to take it easy if my body temperature's up. So that's one thing that I love. But one of the last things from the previous slide was stress and how that impacts or just how that can play into weight maintenance or weight regain. And these are some examples from some of my clients that wear a glucose monitor. So I really like using glucose monitors because it helps give some of that feedback that we can't always see. So for example, things like grazing. And these are examples from 3 different individuals who hit a stressful situation at work. And you can see it bump their blood sugar up more than a meal or a snack. And this really just, I think, expresses how important it is to know how to manage stress in some of these situations. Or, maybe that looks like, breathing exercises. Or I have some people who've even like watched really emotional or stressful movies and they've seen like a spike, which is crazy. So if you're an empath or you just really take on other people's emotions, then this might speak to you a little bit more. But some other things too, if you want to scroll to the next slide.
Sure. I want to say too, there was a question here. Oh, sorry. Are you seeing my chat boxes open and stuff? Because I'm
Yes.
moving them
Yep.
around. You are seeing them open?
I am. I can see the chat box. Is
Uh,
there one in particular for the question?
well, this is actually in the Q&A. It's Denise. She said,
Okay.
"Why has my hunger come back so much over the 2 years plus sugar cravings? I don't eat bread or pasta or rice or sodas of any kind, gastric sleeve surgery." The reason I'm saying it now is because I feel like it's going to affect what you're talking about here,
hmm Yes,
the
and I think
question.
on the I think if you're not doing much of the carbohydrates, it could be some of these factors like, seeing the glucose jump just from like stress management. I think a lot of times too, I previously mentioned just not getting enough fat intake. So sometimes I see, people are doing protein, 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 but sometimes not getting enough fat, or it could be under eating, it could be overeating. So it's hard to say without knowing a little bit more, but hunger specifically, it's natural for it to come back if you are hitting your protein targets, like some of the ones that we talked about earlier. Then the second thing that I'd probably look at is like fat and fiber, because that combination can be really great in terms of planning out your blood sugar levels, but then just adding to like satisfaction. So fiber is going to give you that bulk. So if you feel like, Denise, that you're having a meal and are just like not getting that volume or that comfort, maybe that expansion of your stomach, then fiber, like things like vegetables, fruits, beans, can really help with that too.
Kayla, do you need to have a prescription for a blood sugar monitor?
You do, yes. So
Okay.
unfortunately, right now in the United States, you need a prescription. I know I use a third-party vendor and they handle everything. So I've had some people kind of bring in their own sensors, but what I found surprisingly is there's so many doctors that are really hesitant to prescribe them for, I wish I had a good explanation for that, but I think some physicians, if they don't know how to interpret the data, are a little bit maybe intimidated or don't know what to do with it. So I often end up using mine with a third party, but oftentimes for insurance to cover, you do need some sort of diagnosis, like diabetes, for example, or even one thing I posted about recently is reactive hypoglycemia, which is one complication after surgery where your blood sugar drops really drastically 2 to 3 hours after a meal. You might feel kind of sweaty, shaky, hungry, can be kind of some scary symptoms. So I have had some people get that documented and get sensors covered.
And I also just want to say real quickly too, I know we're right at the hour, but guys, we still have more information for you guys. So as long as you're okay, Kayla, we'll keep going. And if anybody does need to pop off, you're okay. If anybody does need to pop off, know that this will be on replay using the same link. It'll be on replay till the end of the month. It'll be on our YouTube channel next Tuesday. And it'll be on our podcast next Tuesday. So you can always come back and listen again. But we're going to keep going because I think we still got some good stuff.
Yes. And then if I can always share like some of the, if anybody has to hop off, I know you're going to be sharing the replay and the links. I will uh, just pop where did my chat box go now? I'll pop a link just to like the resource sheet, which brings you to like the Berry Connected site as well. And that anything that's underlined will bring you right to the links. So, all right.
Thank you, Kayla.
Yeah. All right. So the last three things of the nine kind of big ones, physical activity. I know on the side here I have nutrition first, activity second. Brenda, I actually thought about like updating the slides and sending them back to you and taking that off because I think for some people, if you're just really not sure where to start, I think nutrition can help. But then, as we're talking about mindset today too, I feel like physical activity is such a huge component of that. So for someone, it might mean just getting some movement in to feel better. And oftentimes that has a positive ripple effect. So maybe please ignore the nutrition first, activity second, if that doesn't speak to you. But I will say, thinking about life after surgery, if you can prioritize any sort of strength or weight training, that is really going to be wildly important. I will make a little asterisk, especially if you're taking something like a GLP-1. If you're losing really rapidly, doing some sort of strength training can just really make sure that you are losing the right thing, and that means fat versus muscle. So I can't emphasize the importance of strength training enough, and do it sooner than later. I know oftentimes I see I'm going to lose, get to my goal, and then I'm going to get my muscle back. And that is so hard to gain muscle. And I think we don't always appreciate that. So if you can hold on to the muscle you've got, you are going to set yourself and your metabolism up so much better in the long run. Mindfulness, I think we talked about maybe a couple things in mindset. Brenda, I know you're on your personal development journey. I don't know if that involves like journaling, but that's something that I've been personally doing a lot more of lately. And I have to say that it has been, a really big help just having, like I mentioned earlier, just clearing your cache, kind of getting some of those thoughts out can really help. Mindfulness might be just eating mindfully too. So finding something that can just help maybe tune into your environment because we're always thinking about the past or thinking about the future, but the more you can really kind of tune into the moment, that can be really helpful. And tracking something. So it doesn't have to be food, it doesn't have to be a weight on the scale. I'll have you maybe scroll to the next one, Brenda. We've got a bunch of
Sure.
ideas just for ideas to track that don't involve calories. And that could be maybe it's just grams of protein. So, one thing I'm doing with my membership now is we did a back to basics challenge. So, we're just counting ounces of water and grams of protein. We're not even focusing on calories because sometimes if you're focusing on those things, the calories kind of take care of themselves. But you can track steps, you can track miles, minutes read, journal entries, really finding some sort of measurable that you can look at so you have progress because the data doesn't lie. And I think a lot of times too, we get kind of wrapped up in our emotions, and it's easy to discount all of that progress that you've done. But if you can look back and be like, wow, I've done 5 journal entries this week, or my husband's favorite is the second to the last, where he likes to count all the times he didn't cave and go in and buy something from the gas station. So I think it's important to recognize those times too, or it's like maybe you resisted temptation, or finding things like that. So I don't know if there's anything you wanted to add on measurables.
No, I think you said it all. And I think that you recently, I was reading I get your emails and I remember seeing something recently, because people get tired of tracking everything. And I know for me personally, really the only time I really do track is when I'm feeling really out of control. Some people really like tracking every day though. It helps them feel like they're knowing where they are. But for me, I usually just use it as a tool to get back on track, or like if I'm feeling like I need my mindset in a better place where I know that I'm doing the right things, it's reinforcement for me in that way. But there's so many other ways to get it that way too. So I like that you're mentioning all that.
Yeah. And I will say too, I think like you had mentioned, when we tend to default to tracking when, like you said, you feel really out of control. And I think we get into that all or nothing a little bit, where it's like, okay, I'm just like willy-nilly over here. So I'm going to be really, really tight. Like I think, when we get into some sort of tracking, it's like we can almost go overboard with it. So finding like that comfortable spot that you're able to measure progress, but not like freak out about tracking every single thing either.
Yeah. And I know it does work for some people. I'm not, please don't say mean things to me about not tracking, but I'm just saying that it's for some people, that some people it works for, and if that works for you, that's great. But there's other ways too to track besides just tracking in a tracker.
And I think too, you didn't have surgery to count calories or track for the rest of your life. And I think, again, like thinking about maintenance, that's part of it, is like finding that spot where you're comfortable without having to track diligently every single day.
Yeah. It's all what works for you. So
Mhm.
here we have your celebrate your progress. And when weight, so this is kind of a little time for you guys to do some extra chat stuff in the chat box. When weight loss slows or plateaus, what other metrics do you track? What do you take note of as far as your non-scale victories? I always think non-scale victories are always big, and lifestyle versus weight goal or goal weight. So I like that because it is about lifestyle, because you can't always control how much weight is coming off and how fast it's coming off. But you can control the activities that you're doing to get there, right? Is that what we're saying here?
Yes. And I see clothes was one. Let's see here, weigh and measure. Or no, that was a tracking comment, I think. Let's see here. I think clothes is a great one too, because I think you can have like those goal pants or something, like those kind of tell a thousand words. Especially like thinking about how we were talking about
Yes.
body composition too. You can weigh the same weight, maybe you've kind of gone up and down and yo-yoed, but maybe you feel a lot different too in your clothes just because your body composition's changed. So I love the clothes. Looks like a couple people are using that.
That's for me one of the big ones is the clothes, because I can always tell if my clothes are fitting a little looser, fitting tighter. Measurements are always a big one for the ability to walk or be stronger, like in the things you're doing. Sarah says, when I'm mad, I get to exercise. Remember, even when I could even climb the stairs without being out of breath. Yes. So that is a big one. And pain. Amanda says pain,
Yes, that's huge.
not
Like,
hurting.
mm-hmm. All wonderful ones. Yes, and that's so the last bullet, I just have to, sorry, I'm jumping ahead a little bit, but Sarah's on and she was the one I stole this from. So the goal lifestyle versus goal weight, that's one of my favorite questions to ask people, thanks to Sarah. So really focusing on like, are you living your goal lifestyle versus are you just kind of chasing that number on the scale? So, and even thinking like maybe giving yourself, what percentage are you to living your goal lifestyle? And I think maybe you're 50%. What can you get it to 55 or 60%, not going from 50 to 100%? So if you're doing half the things that you wish you were doing in your goal lifestyle, what's, that next little step that'll kind of bump that up incrementally?
And Kalisha says non-scale victories are so important to me. I focus on changes on my mindset, energy levels. I love the energy level thing. Activities I can do now, measurements close, especially if I get them on a deal. It's nothing hurts that. So this next one here, the next one here is building a support network. And guys, you're in the right place. I mentioned earlier that I went to a support, I call it a support group, but it was actually more of a program um, reunion. They have one every year for their patients, like a New Year celebration to celebrate all the surgeries for the last year. And there was probably about 20 or 30 people that got up and told their testimonial. And almost every single one of them said support was their one of their biggest things to help them stay successful and stay engaged. Friends and family, professional help. Maybe it's your surgeon, your dietitian, your therapist. Um, could be personal trainer, these virtual communities like you're on right now, whether it be our program, maybe it's a community, there's lots of communities out there, just something, you know, also those additional tools can be helpful, medications, hormone replacement, the CGM that Kayla has been talking about. Like you guys, if you're struggling in some way, find your person. I always watch on Grey's Anatomy. They always had a person. I don't know if anybody's a Grey's Anatomy fan from way back, but find your person. Find your people. The people that you care about and that help you. So, and Kayla, it's okay. I'll take this one here. Um, I have preventing self-sabotage. And the reason why I use the word self-sabotage is because that's what people, a lot of times terminology will say, I feel like I'm sabotaging myself. But guys, think about this way. To me, it's not sabotage. To me, it is self-protection. To me, you're only doing things to protect yourself from being hurt, from being in pain. And a lot of times we don't recognize that those things actually can hurt us. Like maybe it's that you're eating more than what you think, that maybe you're emotional eating, but you're not changing the way you're doing it because um you don't think that you can. And you think, like, your mindset is set that you know you can't be a certain way or you can't do another thing. So you're actually those subconscious thoughts are protecting you. They're keeping you where you are because that's what your mind is telling you. So think about it that way. It's a form of protection, and then start asking yourself, if you haven't seen a change, like look back at your life in 2023 and what changes did you want to happen that didn't happen? Or maybe you see something that you want to change that's not changing. Ask yourself, there's a reason. There's nobody else but you that's in charge of your life. What limiting beliefs are is holding you back? And um like food, emotions aren't good or bad. They're just emotions. And um, instead of judging them, just like listen to how, if they bring you up in a better mood or they bring you down, like listen to what they're telling you. And then also, obviously, setting boundaries with yourself and others can be a super big thing to do to try to. It's okay to say no. It's okay to say no to other people. And to me, the biggest reason most of the time for sabotaging or for protecting ourselves is because we don't want to hurt. We don't want to be hurt. We want to love. We want to be loved. We want to be accepted. And sometimes that means people pleasing or doing things that we wouldn't normally do because we're trying to protect ourselves from being hurt. So
I
gotta
will
do what's
add
important
too,
for
I
you.
think on the resource sheet, I added like along the lines of self-sabotage, I added a book, The Mountain Is You. And we read that in my book club, and it is all about turning self-sabotage into self-mastery, and it dives right into that, Brenda. So I highly recommend that book. It's really good, but you'd be surprised like in the ways that you might be self-sabotaging. So it kind of takes you through exactly what you talked about, Brenda, like how are you maybe protecting yourself with some forms of self-sabotage. So highly, highly recommend The Mountain Is You. So I'll drop that again
Yeah,
in the
thanks,
chat
Kayla.
box. But that book is excellent. And I think something I'll probably make it a point to read every year because I think life changes and, I probably start self-sabotaging in different ways every year. Yeah.
Yeah. And I want to say here too, there's a question about support. And if you guys are here, if any of you are here as a means to a requirement for your program needing to attend so many support groups pre-surgery or for your insurance, I do send attendance to these to about 45, 50 different facilities. So your facility, if you know that your facility is a part of that, know that they'll get the attendance list. And I usually send it 1 week post the event because to catch the replays. But if you're not sure that your facility is in that, send me your name and your email and your program name and their email, and I can definitely certify that you were here. So um, this question here is what's I'm hidden because I have my chat box up. What's one habit you plan to improve? So I think some people is have been commenting on that. We'll keep the comments coming though. Keep the comments coming, and then we have this is Kayla's. We'll let
Yeah.
Kayla do the quote.
I just love this quote. The scale is stuck, but not me. So whether maybe you're like working through regain or, trying to figure out if you're in maintenance or what that looks like, I think just realizing that, you're separate from the scale and the scale might be stuck, but you don't have to be. Mhm.
And I want to say too, just to kind of back that up, guys, when you think you're stuck, you are stuck. Like stop telling yourself that you're stuck. Like there's nothing that everything is movable and flexible just because you're maybe have been had a period of not moving as far as your weight or whatever you're wanting to change. Everything is possible right now. It's all in the moment. It's not the past. It's not the future. It's right now. And so just know that you're never really stuck. It's only your mind that's stuck,
Mhm.
right?
Yes. Yes, and if you're looking for more support, I love like support groups like this. I know ProCare, you guys offer so many great like free resources, and I feel like you have such a good variety of guests. But if you liked maybe meeting me a little bit or just learning a little bit more about like blood sugar, for example, I know no one else really in the bariatric space is using things like CGM, but one of the main things that I try to emphasize with my membership is just some of that blood sugar management, because I feel like when you can get that under control, that can really, really just help and have a positive impact both mentally and physically. So I have tons of resources. We have a monthly book club. So last month we read Finish by Jonna Cuff. So I put that on the or the resource sheet too. Great book for goal setting, and there's a lot of sarcasm and humor. So that book went over well. We read The Mountain Is You actually as our first book, and that was probably everybody's favorite. And then this month we're actually reading The Gifts of Imperfection by Brene Brown. So we really do a lot of, I would say, mindset work during our book club. We kind of dive deep a little bit on there, but in terms of nutrition, I have a DIY macros tutorial. We do monthly challenges. So this month was all about getting back to the basics, lots of resources, recipes. We have live calls. So actually, if you know Rodolfo, he is going to come and visit my group next week for an emotional eating workshop. So I'm super excited to invite him back for that. And then in February, we're talking about self-compassion and self-love. And I actually have a dietitian friend slash makeup artist who is going to come and visit us for a guest speaker and tell us how to beautify ourselves. But with that too, you get one-on-one chatting with me. So if that's something you're interested in, I do have a link on the resource sheet. So you can join monthly. There's no minimum commitment, or you can save 20% with an annual membership too. So I will drop that one last time here. I know, Brenda, you're sharing some of or you were going to
I
show
got a
who
bunch of
where
the
we
links
find.
too. I'll copy those real
Yes.
quick. I
Yes.
couldn't do it while you were on, or while I had the screen shared.
Hmm.
And also, guys, Kayla, I'll let you drop your link, and then I'm gonna go ahead and do you have it there to drop?
I do. I think I just had to get out of full screen mode. I'm like you.
And I'm going to drop here all of this information. Kayla is actually also a affiliate of ProCare, guys. So if you use her code, you can get 10% off your ProCare order.
Can I do my
And I
ProCare plug? I don't know if this, so
yes.
I am very picky, I'll say, especially when it comes to supplements, because that's one of the things that I get a lot of questions about, like supplement wise. And I think I tend to do a lot of research and I'm very always like reluctant to recommend brands because I feel like there's so much out there. And I think one thing that I really value with you guys is you're very transparent, you're third party tested. And I think so often too, it's like, I think we buy from people. So I really love the people at ProCare and all of the free resources that you offer. So I think you really give a great high quality product and it's very cost effective. I think when you compare ProCare's pricing to a lot of the other pricing out there, you guys probably beat everyone. And I don't think you advertise that maybe enough. But again, I think all the free resources and you get people like Brenda and ProCare's so lucky to have you. So I think you get the people with the product
Oh,
as well. Hmm.
thank you so much, Kayla, for that. And thank you, Amanda. I see she's saying look ProCare too. So I appreciate all of you guys so much. So I've just posted in the links in the chat. If you're listening to a replay later, just know that those will be in a description that will be if you're listening from YouTube or from our Very Connected podcast, all these will be in the links. Kayla's contact information, her online community, how to apply for her one-on-one coaching with CGM, her Instagram, her TikTok, her Facebook. We also have Kayla's affiliate link and also her ProCare affiliate code, which is live. And we have her dietitian approved download list. So um, before we end, I have a couple things. There's someone, I don't even know if it's a question, but Charity, I'm just gonna kind of you have a comment here. It says it could be so hard not to compare my current body to my ideal body, even though I've come so far. And I want to just say it is possible. Like just know it's possible. Just know. And then we have an anonymous attendee who said, "How would I know the appropriate amount to have of fat to have? My mom is 3 weeks post-op, and I am not sure how much to suggest for her." Kayla, do you know how to suggest that?
I would say it's always those early stages post-op can be really difficult because I feel like it's a part-time job pushing protein and pushing fluid. So I think as you get further out, a lot of times like a minimum goal I'll have for people is even like 50 or 60 grams a day, which I think some people are like, whoa, that's scary. If you've ever counted Weight Watchers points or counted calories, it's like usually fat is more calorie dense, which doesn't make it a bad thing, but oftentimes that's most satisfying. So kind of thinking about like maybe 3, 4, 5 months post-op, that would be my kind of end target. But right now, it's probably too much to focus on that. I would just maybe focus on protein, fluids. Those are really going to be the big things at 3 weeks post-op, and then those other things will come with time. So I hope that helped.
Yes.
I did drop my email in the chat box too. I don't know that I had that um in the links that you shared. So I just put my email in there. So you're always welcome to shoot me a message and that comes straight to me too.
Thank you. Thank you, Kayla, for doing that. And Melody, thank you. She said she is a bariatric RD in the Chicago area. Oh, I love that. She recommends ProCare, so thank you. And I want to share real quickly too, one more time. I'm gonna go back to the ProCare site and I'm gonna just share you guys how to find all this stuff. ProCareNow.com. When you get there at the top here, you're going to see many different tabs. The products are listed under there. You're going to find bariatric. Whoops, I have I have to move some stuff. I have products there. We have procedures like what type of products you use for those. And then over here under Very Connected, sorry, Zoom has all these different things open for me. It makes me hard to navigate with my little click tab. Under the Very Connected tab, there's Very Connected, our partner programs, our support group handouts. Under Very Connected is where you're going to find all of the events. You're going to find the link for today's event to go back to. If you want to go back and listen to the replay, you can use the exact same link. Just click on register here. It'll show up. And excuse me, or you can go to our Very Connected. I mentioned our podcast. We're on most major platforms. You can find us there. You can find us on YouTube. I'll show you what that looks like. Also want to say too, if you're looking for monthly events, every month we post all of our events on here. So if you want to go back and listen to any of the replays for January, those are on there. We'll have each month, as the month changes, February's will be listed. And next week we have Larissa, who's going to be talking about her 220-pound weight loss. So that'll be exciting. And then our YouTube channel, we move our bar here. Our YouTube channel is just ProCare Health, Vitamins and Supplements. I think somebody had asked about a second slow. We have
During my dietetic internship year,
we have over 194 videos there. Subscribe. There should be a subscribe button when you come onto this page. It'll be there and you guys can subscribe. We also just Very Connected page added our Facebook page and our Facebook group. They're at the very bottom here of our Very Connected page. And when you click onto either of those, you'll go to our Very Connected Facebook page and our Facebook group. So join both of those, the Facebook page and the Facebook group, Very Connect and Very Connected. And then what else? Our handouts. Our handouts for today, if you jumped on late and you didn't know how to get there, if you go under the Very Connected tab, support group handouts, we actually have two handouts. We have the presentation, which we kind of showed you earlier, you know, all of those different slides, if you want to go back and kind of look at those. And then we also have Kayla's handout, which is her interventions and plateaus, or interventions for regain and plateaus. More from her on her community, her grocery list, her guide. All of those links are on there. Her books that she recommends, her podcast that she recommends. And there is Very Connected. So I'm going to stop sharing and just see if there's any other comments. Thank you guys all so much for being here and staying. I mean, some of you guys stayed the whole time. I mean, geez, it was
Yes,
a little
that
bit
was
longer.
amazing.
Oh, I love this. But thank you all. And Kayla, thank you. It's been a pleasure. We appreciate each and every one of you. We wish you the best on your journeys. Any closing thoughts, Kayla, from you?
I think I just want to echo what you said. Like it is, it's really kind of, it's such a mindset game. And I feel like if you think you can, you can. And I think back to that quote too, like the scale might be stuck, but you're not. And hopefully if you're walking away from today's conversation, if you got a lot of information, I would say dialing it down to like maybe one or two things that you really want to focus on, because I know we're coming off the new year. Maybe you're not as far as you thought you'd be by now, or already feeling like you screwed up. I think just really kind of taking a step back and trying not to put too much pressure on yourself and starting with one or two things, I would say.
Yes, baby steps. Baby steps.
Yeah.
Take one little step. Hey, don't be a perfectionist. If it doesn't go perfect, it doesn't go perfect. Just try it. Try something. And there was that list that Kayla has on her slides of different, you know, reasons for regain. Like if one thing isn't working for you, maybe look at some of the others too. Because for me, it was several different things that I needed to really look at. So much love to everybody. And it looks like Amy has one more. How often is this? I was sent by linked by a bariatric surgeon office. We actually have events almost every single week. Our these support groups we usually have once a month. So we have live events weekly, almost. Sometimes we skip a week here and there, and then we have our support groups once a month. So Kayla's my special guest on support groups usually because I told her I don't just invite anybody to be on the support group with me.
I'm so honored. Yes.
She's special. So hopefully that helps. Thank you, everybody. Have a wonderful evening and stay warm, unless you're in Hawaii.
Yeah.
And then just stay nice, I guess. Stay good.
All
Bye,
right. Thank you,
everybody.
Brenda.
Take care. Bye-bye.